In this video, I will inform you about the most important facts you need to know about psoriasis and the ways you can treat it at home. The best ways to treat psoriasis at home. Hi, I'm Dr. Manu, and this channel is all about health and wellness. I help you by providing certified scientific information in a simple and cohesive way. Now, let's dive right in. What is psoriasis, and what are the symptoms? Psoriasis is a common recurring autoimmune disorder. About 2% of people living in the United States have this condition. Cases of psoriasis have been on the rise for at least 3 decades. There are various types of psoriasis, but the versions of this condition can be divided into 2 main differences: those that produce red, inflamed patches on light skin tones, and purple or grayish color or darker brown patches, and those that, in addition, degenerate, also affecting the joints and nails. Psoriasis symptoms can include raised, inflamed patches of skin, scales, or plaques that develop over inflamed skin, dry skin that is more likely to crack and bleed, pain and itching around affected areas, thick and pitted nails, and painful swollen joints, which is arthritis, another form with which chronic inflammation can occur, which over the years can lead to deformation of the affected joints. Psoriasis is characterized by cycles of sudden severe symptoms, followed by periods of remission. This varies from person to person, but most people go through this cycle. What causes psoriasis? As I said at the beginning, psoriasis is an autoimmune condition. Autoimmune conditions are the result of your body attacking itself. In the case of psoriasis, white blood cells known as T cells attack your skin cells, resulting in an inflammatory process that leads to the overproduction of new skin. Genetics plays a role in this mechanism. If you have an immediate family member with psoriasis, you are at an increased risk of developing the condition. The symptoms of psoriasis often develop or worsen due to certain triggers. These can be environmentally or physically related. The triggers vary from person to person, but common psoriasis triggers include exposing yourself to cold temperatures, obesity, drinking alcohol or drinking too much alcohol, smoking, eating foods that contain arachidonic acid and are pro-inflammatory, such as meat, especially red meat, eggs, and all dairy products due to casein. Other common triggers are having another autoimmune disorder, such as HIV or rheumatoid arthritis, having infections that cause a weakened immune system, such as strep throat, having a skin injury, such as a cut, a bug bite, or a sunburn, excessive stress and tension, gluten, any processed foods high in sugar, salt, and fat, the consumption of plants that contain solanine, such as tomatoes, white potatoes, eggplants, peppers, and lastly, certain medications, including lithium, beta blockers, and antimalarial drugs. How can I reduce psoriasis symptoms? Both the symptoms of psoriasis and their severity and frequency can be mitigated through a series of measures. These include implementing lifestyle changes, applying topical medications, taking oral medications, or receiving injections to reduce uncomfortable psoriasis symptoms. In this video, I will limit myself to writing the measures to be taken regarding the lifestyle. As seen from the triggers I listed above, many of them relate to lifestyle. This should not be surprising given that the vast majority of autoimmune diseases, although they may have a basis of genetic predisposition, are triggered by factors that can be prevented and whose symptoms can be mitigated by the same precautions. Correct nutrition is essential. Apart from avoiding the products already listed above, it is necessary to aim for a whole anti-inflammatory diet, full of antioxidants and vegetable fibers. One of the connections that modern science is only recently beginning to study is that between the digestive system, in particular the intestine, and pathologies in the rest of the body, including autoimmune ones. There is emerging research that suggests probiotic supplementation delivered to the gut may benefit skin conditions, and specifically the symptoms of psoriasis. The beneficial action is due to a reduction in inflammatory processes, as this study pointed out, for example, in which psoriasis patients who received the strain B infantis 35624 had an improvement in inflammatory markers. Other beneficial actions are also due to an increase in the effectiveness of the immune response thanks to the immunomodulating properties and a reduction in stress-inducing mechanisms thanks to the influence that enzymes and gram-positive bacteria have on the endocrine and nervous system. Adopting a diet with a higher quantity of vegetable fibers and foods containing water also naturally helps to maintain the right body weight and to lose excess fat. As listed above, obesity is also a trigger. Another factor besides nutrition is sleep. It sounds strange, but most people take for granted how important it is. to have the recommended 8 hours of sleep every 24 hours. Sleep affects every single biological process that takes place in the body. Quoting from the best-selling book Why We Sleep by Matthew Walker, neuroscientist and university professor of neuroscience and psychology. 2/3 of adults throughout all developed nations fail who obtain the recommended 8 hours of nightly sleep. Routinely sleeping less than 6 or 7 hours a night demolishes your immune system, more than doubling your risk of cancer. Insufficient sleep is a key lifestyle factor determining whether or not you will develop Alzheimer's disease. Inadequate sleep, even moderate reductions for just 1 week, disrupts blood sugar levels so profoundly that you would be classified as pre-diabetic. Short sleeping increases the likelihood of your coronary arteries becoming blocked and brittle, setting you on a path toward cardiovascular disease, stroke, and congestive heart failure. Sleep disruption further contributes to all major psychiatric conditions, including depression, anxiety, and suicidality. After hearing all this, it is no wonder that scientists have discovered that, another quote, sleep deprivation plays an important role in the exacerbation of psoriasis through modulation of the immune system in the epidermal barrier. Thus, sleep loss should be considered a risk factor for the development of psoriasis. Another key factor is stress management. Stress-inducing events are almost everywhere, and psoriasis attacks in many cases contribute to adding even more stress. Learning techniques that facilitate relaxation, such as deep breathing, meditation, tai chi, and yoga, can be effective. Taking long walks in nature, listening to relaxing music, hitting a massage, and taking a moderate temperature bath can also be added methods. Calorie restrictions and fasting. Periodic water fasting can be used as an adjunct treatment for autoimmune conditions. Fasting allows the body to recover and clean out damaged molecules, as well as reduce inflammation with greater effectiveness, not having to use its energy to process digestion. This can help reset your immune system. If you are on drug therapy, consult with your doctor before fasting, as some drugs cannot be taken on an empty stomach. Calorie restriction can also reduce psoriasis symptoms, but its effects are more moderate than fasting. Lastly, there is exercise. The National Psoriasis Foundation recommends that people with psoriasis do at least 30 minutes of moderate exercise plus strength training at least 5 times a week. As with any other precaution listed above, this should also serve to reduce the frequency of symptoms and their severity. But more attention should be paid to body hygiene after sweating, because if sweat stagnates, it can increase local inflammation in those with psoriasis. Additional supplements to help. The main supplements that have been shown to help reduce psoriasis symptoms are vitamin D3, cholecalciferol, whose action on the immune system and the skin is so complex and multifaceted that I would have to make a video only on this to be able to summarize it. I'll just limit myself to mention, here on the screen, the number associated with the links of the studies that you can find, as always, in the description below the video. Curcumin, which is a component of turmeric plus piperine plus ginger plus black pepper. This set of spices extracts has a synergistic action with each other, giving powerful antioxidant, anti-proliferative, anti-inflammatory, antiviral, antibacterial, and antifungal effects. Moreover, curcumin can also be used locally by applying it as a gel. Omega-3 DHA and EPA. Taking these fatty acids helps reduce inflammation and thus can reduce psoriasis symptoms. Unfortunately, omega-3 supplements derived from fish can be highly contaminated with heavy metals, pesticides, and microplastics. Furthermore, being a concentrated animal product, it contains cholesterol in high doses. It is highly recommended to use the omega-3 supplements DHA and EPAs derived from algae. In this way, every single negative component listed above is avoided, as there is no risk of biological accumulation of dangerous substances in the body of any animal, which is then used in the process. As this study says, I quote, "Some of the reasons why an algal oil could be preferred to fish oil are improved taste properties, sustainability, avoidance of contaminants currently found in ocean waters, lake water, river water, and complete suitability for a vegetarian or vegan diet." Lastly, one product to use locally to reduce symptoms is aloe vera. One 2010 study compared aloe vera to 0.1% triamcinolone acetonide, a steroid cream used to treat psoriasis. The study found that aloe vera gel was slightly more effective in improving symptoms from mild to moderate psoriasis. But this is based only on a single study. Since the risks of contraindications are very low, Despite the lack of clinical evidence, it is considered valid to try. Research is also currently being carried out on tea tree oil and Oregon grape, but there are still no clear results from them. In a nutshell, psoriasis is an autoimmune disease that, as far as modern science knows, can only be contained, but not cured. Through lifestyle improvements, the quality of life of those suffering from this condition can significantly improve. Furthermore, the same precautions that improve the symptoms of psoriasis are effective prevention and containment measures against many other pathologies. If you like this video, don't forget to like, subscribe, and hit the notification bell to stay up to date on new content. Thanks for watching.